Just going to give you a brief update on what's going on with FACT. I'm not sure how many of you, this may be your first time hearing about FACT. Please, take some brochures with you, visit our website. We have a whole lot of information to share. But FACT is a nonprofit organization that has two goals in mind. And those two goals are prevent the need from families coming into a crisis or a child welfare situation. And for those who are in a child welfare situation or foster placement, how can we make that experience different? Goal one is our focus right now. The need for prevention is great, and we can do better for our families and children in Genesee and Saginaw counties. So about a year ago, we started the envisioning groups with Genesee and Saginaw. We meet once a month. Our Genesee group meets Tuesdays at 9, and our Saginaw group meets Tuesdays, the second Tuesday at 11:30. The organizations that we've come to know and come to share information and collaborate on have been so beneficial, because when we look at our community and what makes up our community, we can't dictate what people want or need. We have to listen, we have to learn, and we have to be able to work with one another in order to make services happen, in order to help people get out of our boxes. And these envisioning groups have certainly opened those doors wide. Each group has its own work plan, its own goals and objectives, and we work through those goals and objectives together. So for example, in Genesee County, one of our objectives was to start with caregiver dinners. So happy to report that we had our first caregiver dinner at the Flint Public Library just about mid-June. And the coordinated effort from our organizations that were in that Genesee Envisioning group was incredible. They helped with finding a couple of families to bring. We partnered with books, we partnered with meals, we partnered with information, but we all walked away with this sense of, this is our purpose, this is why we're here. The families that we were involved with that came to that caregiver dinner were so engaging. And our whole purpose at the beginning was just to get to know people, get involved, give somebody the night off from having to cook dinner, but more importantly, be together with their family. So the children were there with them. We had the most outspoken 11-year-old girl because we had put questions at every table about community, what does well-being mean to you, just different things like that, or what activities we wanted youth wanted to see in the community. They were so genuine and honest and very direct in some cases. The one 11-year-old girl is going to be a future politician, I don't know, attorney, something, because she has that drive. She has that advocacy within her already of what is needed, what can we do better. And so for us, it was such a welcome opportunity. We also got to learn about, there's a couple of communities, especially in Flint, that are in great need, that don't have a grocery store, that don't have access to healthcare, that transportation is a barrier. They fight hard for what little they have in their community. They're proud of their community, hear me. They are so proud, but this mom was very eloquent in speaking and very purposeful in her words. And that also resonated a lot with us that evening, because we have a lot of work to do. I mean, it's hard to follow with Dr. Moore, let me tell you. Because what she brings and what she's doing for our kids and families here is is insane. It's incredible. It's something that's life-changing. And it's something that I don't think any of us would have thought would have ever come to fruition. So, I know I get off topic a lot, sorry. But that caregiver dinner is leading us to the next one. They're helping us plan. We've had feedback. We've had good comments, not anything bad, but just different comments about, well, maybe next time we can try this. But what we're gaining from all of that is community leaders within the community. They're not being paid. They're volunteering their time. They're giving us their feedback. They're giving us of their time and of their energy. And that is so invaluable to the work that we have to do here. So our envisioning group for Genesee is in August, mid-August. And I have a family out of Burton who is ready to pick a spot and ready to help us make that happen. The good thing is in Saginaw County, our first envisioning group will be in September. And so as of right now, we're looking at a location that's centrally located. Did I say caregiver dinner? I say that wrong. Caregiver dinner. So that will be in September. So we're very excited to be able to launch that. And again, within that envisioning group in Saginaw County, that's one of those goals as well too. Now, when you look at our two envisioning groups, each have a different agenda in some ways. Saginaw is more focused on education, really focused on how we can connect, interact, work with our children at a younger age because they're coming into middle school and there's so many behavioral health issues that are behind, and teachers and support staff are struggling because as we all know, as children get more behind, their behaviors go up because they're trying to avoid the embarrassment, they're frustrated. And so when we talk in our Saginaw Envisioning Group, we talk a lot about education and integrating in with the schools. Not to mention, we have Great Lakes State Health up there in Saginaw, who has school-based health programs, and they are expanding every day. We're going to hear from Lionel from Can Council, who has a mobile prevention unit, again, in the community, with the community, making it a better place. Health Equity Council, Joyce Seals, and her team are looking at all the disparities that's happening within Saginaw. She's pulled together an entire community, different walks of life. There's a whole host of people that are working on 4 main goals to help improve health, welfare, behavioral health, and well-being in Saginaw. That's something that we can tap into. When we look at FACT, and I talk a lot about the communities and the interactions, FACT wants to be that resource. FACT is going to be that resource so that we can help support our workers, we can help support our therapists in the community with resources, person on the phone, person coming into your office, being able to be that consummate professional to be able to say, hey, you know what? I know Mothers of Joy down the street. They have some incredible parenting programs. Let's call up Sharice and see what we got. That's what we want to be. We want to be a part of that community. That's why we're continuously looking for the feedback. We're continuously looking at those ideas and brainstorming because it's a constant improvement process. So visioning groups, caregiver dinners, those are just a couple of examples. Today, bringing all of you here today was so important, simply because this is a room full of great minds. This is a room full of incredible ideas, but also some of us have lived experience and can understand what it's like. Those are the things that we need to tap into, and those are the things that we need to continue to focus on. FACT has also been very active in the legislature. We have worked with Representative O'Neill. We have worked with, who's out of Saginaw. We've worked with Representative Martis, right here from Flint. We've worked with Senator Kristen McDonald-Rivett, Senator Cherry, because we're advocating for more funding. We're advocating for more funding for prevention, for resource services. I can tell you we're not in the budget this year. We were not successful. That doesn't mean we're not giving up the fight. So, you know, it's a labor of love and has to continue. But I also have to say, through our interactions with different legislators and testifying in front of the House Subcommittee and the Senate HHS Subcommittee, we have an opportunity because of the organizations that we are collaborating with to band together and advocate. Advocate for our services, advocate for our families. And those envisioning groups are just another way to be able to do that. So a lot of lessons learned. Some are a little bit harder than others, but it's, again, it's worth the fight every day. It's worth the fight every day. What else do we have going on? You know, as we roll out, we do have a grant with DHHS to provide services and supports for category 3 and 4 cases, CPS cases who have been unsubstantiated. And it gives us an opportunity to help reach out to them, provide a lending ear, listen, and see if there's supports or services that we can link them up with. Because again, for whatever reason, CPS was called, it wasn't substantiated, but that doesn't mean that they don't need help. It doesn't mean that there's nothing going on. And I'm not saying that it's bad, because we all know that neglect and poverty are the highest reasons why CPS is involved. Is that a reason for removal? Absolutely not. Is that a reason for intervention? Absolutely. And so that for us is certainly a huge opportunity as we go live October 1 in working with those families. We do know the challenges. Most folks are going to want to talk to us because they're thinking that we're a part of CPS and we're going to get it back in the system. It's not the case at all. We're looking to help them get further away from the system. Give them something to help improve. I can tell you Genesee DHS, all that over there, their prevention services department has been incredible, giving us resources, helping us with contacts, really wanting to collaborate because again, there's varying levels of prevention. Prevention happens in different places and we want to be able to coordinate, not walk over one another and not duplicate services. That's really, really important. So again, we appreciate, you know, our partnerships across the community with our DHHS partners, both in Saginaw and Genesee counties. And we look forward to that go live date. Are there things we still need to iron out? Yes. But I can tell you one thing that is going very well right now is that we've created, or we found, and are creating an IT system called My Argos. My Argos is different. My Argos has the opportunity for us to be able to connect via portals so that if we do a referral and we need to have feedback, we have the technology to be able to do that. They are testing the provider portals as we speak. The information that's in there, the information that we're collecting is minimal. We're just looking at what are the barriers, what are the opportunities, and how we can provide those services. It's also about connecting, giving referrals, and looking for that feedback. Did they show up? If they didn't show up, why? Can we call, you know, let's call them and see if we need to be on the phone with them to help with that referral. I don't know about you, but I hate calling for pizza. I will refuse to call for pizza because I don't like being on the phone and somebody going, well, what topics do you need? I don't know. You remember, there's too many questions. It creates anxiety over pizza. Imagine what some of these families are going through when they say, here's a referral for whatever, therapy, food bank, you name it. And somebody has to get on the phone and say, I need help. That takes a lot of strength, but also takes a lot of anxiety and a lot of reasons not to make that call. So if we can help with that, that's certainly one of the things that we will be doing. The other thing is our hubs. So currently, we are looking to solidify a partnership with Power Elementary over here to have a mini hub. So what that does for us is it puts us in the community, but it also gives all of our partners the opportunity to have an additional space to be able to meet the family, and they can cover multiple services at the same time. And it's in a space that's trusted, that's safe, that's non-judgmental, and we're only looking to help them move forward. Those hubs, beyond just being that secondary space, is also a place where we can help expand with additional supports. So if there is someone who needs diapers, or there's someone who needs food that expand beyond what the food bank can do, or it's an emergency, we'll have some of those supplies at the ready. Again, it gives us another vehicle with which to reach out to the community and reciprocate what they need. And then that way we can utilize our organizations to be able to help fill that as well. So, I think I'm just, how much time do I have left? Okay. So for us, there's so many things, and there's so many great things, there's so many great people. I can tell you the Saginaw Valley State University has been incredible. We were able to create an IRB, and we had focus groups on well-being, community well-being. Had the opportunity to be able to talk to community members, those with lived experience, and be able to understand what is it that you need? What is it that will help you be more comfortable, be less stressed? There was varying themes that occurred from that. I have to look at this because I don't remember everything. And my poor cat is not here today, so he's actually over here and I can see him, but he couldn't make it today because he speaks so much more eloquently than I ever could about focus groups and about those interactions with those families, because that is his baby. But what I can tell you is talking about, in my community, I have a lack of access to a grocery store, to a medical clinic. I have transportation issues. I have, but I have the support of family. I have the support of neighbors. And that's part of the community that keeps them all going. No matter where you are, it doesn't matter what community, it's in your own backyard. What is it that keeps you going? But what is it that's preventing you from having a sense of well-being? And so those were some of the themes that we learned about. We're expanding that IRB. We're actually closing it out and updating that IRB for this year, and working with Saginaw Valley again and the MSW students, some of which are here today and worked on our evaluation. So we thank you so much for all of your hard work. And it's publishable. So that's another thing, that's a great thing for us. That's something we can share. It's not just here, it's for everybody. And I think that's what's also really, really important. Finally, I have to thank Family Justice Group, Jerry Milner, David Kelly, our facilitators today. These gentlemen come from, he was Alabama State DHS Justice Director. He was also the director of the Children's Bureau. David is an attorney. He's just an okay guy. But David is an attorney and has been a fierce advocate in Massachusetts. He's also worked side by side with Jerry for many, many years. And they have a wealth of information. They have seen so many different sides of crisis and community, and how prevention services, true prevention services, can bring such a positive influence to so many lives, whether they're working with judges, whether they're working with community organizations. They're in a few states, so they travel around quite a bit. But they have certainly taken us under our wing, and we couldn't be more proud to be a partner with them. So just wanted to acknowledge that today. Sure, I'm missing other things, but it's time for me to get on this stage. So again, I thank you so much for all of the hard work, for the dedication, for your wisdom, and we just look forward to continue to do community together. Thank you.